Good afternoon. My name is Ulf Smith and I'm here together with two experts for a discussion about the ectopic fat and what have we learned about the ectopic fat over these couple of days in the symposium here in Quebec City. And together with me I have on my left, please introduce yourself.
I'm Marja-Riitta Taskinen from Helsinki, Finland.
I'm Mike Jensen from Mayo Clinic in USA.
Okay, and I'm from Sweden. So we have had very in-depth discussions here these last couple of days about the consequences and the effects of abdominal obesity and visceral fat or visceral obesity. And we have learned, I think, that BMI as such is not the best measurement of individual risk for cardiometabolic disorders, but that the waist circumference is a very important added risk marker. And this probably is a consequence of having fat accumulate in other sites, what we call ectopic fat accumulation. So the first question would be to Marja-Riitta Taskinen, and that is, we know that fat accumulates in, for instance, the liver, and what are the consequences of fat accumulation in the liver in terms of the cardiometabolic risk profile?
The liver is a very central organ because it produces a large plethora of different cardiovascular risk factors, including different lipids like triglycerides and also HDL, and also factors linked to hypertension as well as inflammation, and of course glucose. And therefore, if there are abnormalities in the liver, those will be reflected also in the production of these risk factors. So fatty liver is really overproducing all these cardiometabolic risk factors.
Such as what? What happens, for instance, to the lipids? Because that is important for cardiometabolic risk.
The lipid accumulation in the liver, in fact, reflects the imbalance between those lipids which are coming from the circulation to the liver and those lipids that is export, which are leaving the liver. And if there are imbalance, you get lipid accumulation, and we are talking then about the fatty liver. And this one way how to get out lipids from the liver is to pack them in so-called lipoproteins. And these lipoprotein particles are triglyceride-rich and they take out fat from the liver, but then they will end up in the circulation, and in clinical practice they are measured as elevation or serum triglycerides.
And that could have consequences also for HDL cholesterol and other markers of risk for cardiovascular disease.
Yes, because this overproduction of these triglyceride-rich lipoproteins is immediately reflected also in the metabolism of LDL particles as well as HDL particles. And we get a picture where we have the three musketeers, elevation of these large VLDL particles, preponderance of small dense LDL, and lowering of HDL particles. And these all are metabolically closely linked.
Okay.
And this is called the atherogenic dyslipidemia.
Okay, so one consequence of having ectopic fat in the liver, for instance, is to export it through mechanisms which are not very good for the organism and for the vessels, etc. So do we know anything about what happens in the heart itself? When
we have increase of intra-abdominal fat, then of course there is the direct flux via portal circulation to the liver, but then there's also flux to other organs, and heart is very close to the liver. And the very recent data also indicates that there will be fat accumulation around the heart, that means epicardial and pericardial fat, but in addition to that, also in the cardiomyocyte, in heart muscle.
So also in the cells in the heart, you also see accumulation of lipids as part of this ectopic fat accumulation that we have.
Exactly. And if we consider all these three components over there, epicardial, pericardial fat, and fat in the cardiomyocytes, we can talk about the fatty heart also.
Very interesting, thank you. I'd like to ask Mike Jensen then, not everybody who becomes fat, as we usually measure it with BMI, certainly show these consequences, such as what Marja-Riitta Taskinen was talking about, lipid disorders and others. So there are other mechanisms which then may be related to the accumulation of ectopic fat. Or what would you say are the consequences that some individuals become fat, but they certainly don't show these consequences?
Yeah, and it seems that the most likely way that can happen is people have either a constitutional or a genetic ability to expand their fat depots, yet the cell function remains normal. Whereas other people with the same amount or even lesser expansion have extremely abnormal function of their fat cells in terms of the ability to take up and release fatty acids appropriately. And then when the fat cannot do its job for whatever reason, then it ends up in the liver or the heart, muscle cells, causing damage. So a big area of research is what's different about the people who gain fat but the function remains normal compared to people who gain the same amount of fat whose function is abnormal. If we can understand those differences, I think it opens up whole new areas of treatment for people with metabolic disorders of obesity.
Do you have any ideas?
Well, I think there's a couple of possibilities. One would be, the most likely one is that people who gain fat in a healthy way are able to expand the number of fat cells. They don't have a lot of inflammation going on in their adipose tissue, and they don't have quite as large of fat cells, which suggests that the fat cells don't have to expand to such a degree to recruit new fat cells as they come in. And the suggestion is people with smaller fat cells and less inflammation in the tissue have much better regulation of storage and release of fatty acids.
Okay, so this is what may happen in the adipose tissue, and just to emphasize this, for instance, the effects of the thiazolidinediones that we've been using for many years to treat type 2 diabetes has been implicated to be to a major extent through, for instance, the ability to recruit new cells and store fat in the subcutaneous adipose tissue instead of the ectopic cells, ectopic fat. But there is another possibility as well, which may add on, and that is that if we can burn fat more efficiently, it would also be protective. So, for instance, skeletal muscle would also play an important role. Do you want to say something about this?
Yeah, and I think that's where the issue of physical activity comes in, because unless you really uncouple the mitochondrial function in muscle cells, it's very difficult to burn more fat if you're sedentary. And so a bit of physical activity probably goes a long way toward unloading some of this ectopic fat within muscle cells. There may also be people who just, their cell function is such that they don't take up the excess fat from the bloodstream. They're protecting themselves in some way. So there's a couple of ways I think you could stay healthy even despite having excess body fat.
So in this discussion, we've been talking about the accumulation of ectopic fat in the liver, in the heart, as negative consequences. We've also been emphasizing protective effects, such as the effects of the skeletal muscle and oxidation, and that physical exercise would increase oxidation and be helpful in terms of protecting against the consequences. Okay, with that, I want to thank all of you here. Thank you very much.